The brain is very fascinating because it's the undiscovered frontier in the human body. When we were learning in university in medicine, there were lots of parts of the body which were fairly well understood, not all the details necessarily, but the brain remained mysterious. And as a result, there were many conditions and diseases which affected people which had no answer for. And it raised lots of questions and made me curious. When I first started working in this area in the brain and brain rehabilitation, it felt like an academic exercise to me until one of my close friends was struck by a bus, and she sustained severe brain injuries. And ever since that episode, I began to perceive things very differently as I saw how she recovered and how she regained function and how she changed the way her goals in her life. It made it very real to me how a human being is affected by a sudden severe injury, an accident and trauma, and how it changed the path of their life. But at the same time, it also showed me that not just that in an abstract sense, but in a very emotional sense, and I began to appreciate what it meant like to our patients, their carers, and their family, and how to rediscover hope in the context after suffering a severe life-changing event. In the last 10 years, there's been lots of new treatments and lots of new medications and tests which we can peer into the human mind and see how thought works, how the different aspects of thought, memory, executive thinking, short-term memory, long-term memory, more complex emotions, all these things are now analyzable using modern scientific methods. We can implant brain pacemakers and chips into the people's brains to restore certain functions, and it's likely that we will be, in the next decade, we will be able to do much, much more to improve patients' lives.